see. Ta-da. Ha, okay. So that's a difficult act to follow. I would just like to put that out there, positioning your awesome research study immediately after the inspirational story. It's a high bar. Anyway, so I'm Anna Christensen. I work for a company called TRINS. We're a contract research organization dedicated to neuromuscular research. And I'm here today because I'm here to share about one of the projects that we support, which we're super passionate about, CureDuchenne Link. And first, I just want to welcome everyone. I'm amazed to be here with you guys in person and everyone who's here online. I'm so glad that we're all able to do this together. So if you're like me, and maybe you only had your second cup of coffee, but not your third, there's just 3 things to remember today about CureDuchenne Link. So CureDuchenne Link is a research project, and it's collecting samples, survey information, and medical record data from people with Duchenne and Becker and from carriers, and participation is totally voluntary. If you're here in person, please visit the booth to enroll, schedule your sample donation, and have all your questions answered. Our team is amazing. They're doing a fabulous job. And if you're too embarrassed to ask your question today in front of the big stage and the things, feel free to go do that. If you are here virtually, you can also sign up from home today by visiting our website. And last, if you are here in person, you can donate a sample while you're here in Florida. And so we can help you complete your consent form and schedule your sample collections either here or when you get back home. So this project came out of something that all the families in the room already know, that living with Duchenne is complicated. And so here's the thing, everyone here wants the same thing. We want safe and effective treatment options for everyone with Duchenne. But to get there, we need research. And doing that research has been hard because Duchenne is a complicated disease. So here's one way to think about it is, okay, so if you're a family here who is caring for someone with Duchenne or has Duchenne yourself, raise your hand or thump your table if you see one provider or healthcare worker for Duchenne. Okay, thump the table if you see 2. Really? Nobody's seen their occupational therapist and their PT? Okay, how about 3? Remember, we're talking about your special education providers, all the people on your IEP, your physical therapist, your neurologist. You get the idea. And the thing is, that makes it really hard to do research about Duchenne. It makes it hard to figure out what's going to be happening at any given point in time and tell that story in a really efficient way, and especially difficult to do it at scale. And the other piece is that we've been very fortunate in Duchenne. One of the things we're fortunate about is we have a much stronger understanding of the natural history. We understand a lot about biomarkers. We understand a lot about outcome measures. But it's really hard to put that together with other kinds of data at the large scale across the US. So we can say something about this group of people over here with their quality of life, and we have this other group over here who has their samples sitting in the refrigerator. But it's really difficult to put the 2 together. And so that's where CureDuchenne Link comes in. And so it's a data integrated biobank. So it's open to any person of any mutation, age, or mobility status to be able to participate and contribute this data and samples that tells the whole story, not just part of the story. And that's what we're trying to do. And so the idea is you get a really big and diverse group of people who are all living with the same kinds of conditions and collect the data and the samples that hopefully together can tell the story in an easier to use way. So what makes CureDuchenne Link different? So if you're a family, really it's important to know that this is one holistic approach. So this is one project bringing lots of different kinds of samples and data together in one location. It's also important to know that this is independent data collection. So it's not linked to one drug company. It is not linked to one hospital. It's cutting across sources across the country. And also, as I mentioned, it offers a way to participate more flexibly. So you do your surveys from home. You can donate samples either at home or near home. And so if you're a researcher or you're here with one of the sponsors of this event, this project is designed with FDA submissions in mind. And so what that means is this is integrated data. This is not just samples or not just data, it's putting the whole story together. And it's a platform with community-wide reach. And because it's a long-term project, we hope to shed some light on the Duchenne and Becker journey. So CureDuchenne Link is a way that we think families can really make a big impact by sharing with us the things that you guys already know and pulling in the information from the medical records that your providers already know and providing the samples that can help tie the whole story together to really help propel research forward. So that's enough for me for the moment. I would like to invite to play a video statement from one of the folks that we hope will use this type of resource so you can get an idea of what they're thinking about.
Hi, everybody. I'm Kevin Egan, and I'm the head of research and early development at BioMarin Pharmaceuticals. And I'm here to say a few words about why I think the CureDuchenne Link effort is so important, and also why I think it's important for all individuals who have a stake in developing new therapeutics for Duchenne. Now, really, one of the major challenges that everybody has for trying to develop new therapeutics is a fundamental understanding of the condition itself and the way that it unfolds in children and families that are affected by it. Without that deep understanding of the condition, it's very hard to quantify and assess and evaluate how a therapeutic intervention improves the lives of those living with Duchenne's. And CureDuchenne Link is really at the heart of that understanding. And there's really nothing more central to accelerating therapeutic development in Duchenne's than having that sample or those samples from individuals that will be donated into CureDuchenne Link for understanding how an intervention can change things in the future. You've got to know where you are to understand where you're trying to go. And that's really why this collaboration ultimately between those who will take advantage of the materials and the biobank are so invested in it, along with CureDuchenne, and why it is so important for families living with Duchenne's.
Oh, there we go. There's my mic. So I love that idea of you can't know where you're going unless you know where you are. But the key to unlocking all of this is all of you guys. So online or here in person, I just really want you to know that for this project, it's really important that we try to reach as many different kinds of people as possible. It's not just one mutation. It's not just one people who are walking. It's not just people who aren't walking. We want the whole story. Every exon's important. Every person's important in this. And when you participate, we keep everything coded very carefully to prevent others from knowing who you are. So what that means for you is that when you contribute samples and information, we take out the name and take out all the information that would tell someone who you are and give it a unique study code so that we can share this information in a safe and good way. And as you've heard from our statement, we've already had a fair amount of interest from researchers, which is super exciting. And so that's where you come in. So there's a couple different ways you can participate. If you want to keep it easy, you can fill out some surveys. This is stuff that you guys already know and are already telling us anyway, and you fill it out on your mobile device of choice in an app or online. Now, if you want to do a little bit more, or if you're here this weekend and it's super easy for you, or if you're excited about this, then you can contribute biosamples. So that can mean giving blood, saliva, or urine up to about once or twice a year, depending on what it is. And if you really want to, you can talk to us about how you can donate a muscle or skin sample. You can also provide consent to allow us to look at your medical records and collect that data in a central location. This is the stuff your medical providers already know. So it's really putting together the story all together. And it's important to know that the way we have it set up is that you don't need to go anywhere. This is stuff that you can do at home or close to home with our team. So here's how it works. There's 4 big steps. First, you register online, and you can register your whole family at the same time, and it'll walk you through it. It's very simple. Next, you do some consent paperwork, because what's research without a consent form? And then you'll fill out a survey about who you are and where you've been so far. And then you'll upload some documents to document what your diagnosis is. So whether you're a carrier, somebody living with Duchenne or Becker, there's lots of ways to do that. And so overall, this is a pretty smooth and easy study to do. You just need to get started. So it takes about 10 minutes to register each participant. You only do that once. The surveys take 30 to 60 minutes per participant, completed once or twice a year. Confirmation of diagnosis takes up to 10 minutes per participant, and you only do it once. We would prefer a genetic testing report if you've got it, but if you don't let that stop you. We have some other things that you can do. Sample collection, if you want to do that, if you're not here with us in person, it takes 2 phone calls to coordinate. We send the kit directly to your door. It takes 15 to 30 minutes per participant to collect the samples. Super straightforward.